All right, Samantha, welcome back into the office. As you know, my name is Dr. Perez, and I have you in today for an extensive hand and arm exam. So I'm going to be having a look at your hands as well as your forearms. We're doing a couple different things, mostly some mobility testing. I want to have a really extensive look at your joints and your skin, make sure there's nothing concerning going on, and I'm also going to be taking some measurements, make sure everything's fairly symmetrical and that there's nothing worrisome happening.
Sounds good.
Okay. So I will be taking a couple notes as we go through, mostly of your measurements, just so I can keep track for your next appointment. Okay. All right, so we can go ahead and begin. Let's see. So I'm just going to Any particular concerns today with your hands? Any pain?
No pains. I got a little bit of some scratches, but that's mostly from work.
Scratches from work, got it. Okay, so I will have a look at those for sure. And then of course just documenting if I notice anything abnormal from one side to the other. And then I will be taking measurements for both hands as well. So we can go ahead and start with just an overall inspection. So I'm just going to set this aside for a minute, and I am going to just place a cloth down on the table. It's just for your protection. So just sterile cloth here. And if I can just have you place your hands on the table in whatever position is comfortable for you. I'll just begin by sanitizing my hands, of course. Beautiful henna on your arm there. I love that.
Got it done about a week ago, but now it's starting to fade.
It still looks good though. Looks pretty fresh. So let me just see. Okay. So because you do have a couple scratches, I'm going to start off with a pair of gloves. Once I assess and see that there's no open bleeding or anything, I will remove them later in the examination.
Sounds good. I think by now they've kind of mostly scarred over.
Okay. And you said those are from work? Mm-hmm. Okay.
Paper cuts from boxes.
Unavoidable. Yeah. Okay. All right, so I'm just going to begin with the basic visual inspection, just kind of have a look, notating any abnormalities as well as the scratches. So just looking for any bruising or anything. Is it okay if I go ahead and touch your arms? Just gonna start by having a look at the elbow area. So skin tone is even. Do see a couple freckles here and there. I'm gonna do a joint assessment so far, not noting any swelling. You have very healthy nails. It's a good sign. See a small mark there. Fingers are just a touch cold. Do you tend to have colder hands?
Hands and feet.
Hands and feet, okay. Definitely have a look at your circulation. Okay. And then as far as the side again. Aside from the obvious henna, I'm not noting any abnormality. A couple of freckles here as well. Again, nails are very healthy. Okay, so I do see just a scratch here and there. Very superficial, and they do appear to be healing appropriately. Any pain or discomfort associated with those?
No, not when I got it when I got them, but other than that, no.
Okay, and how long has it been since you got this one?
Last week, I think.
Okay, so it's fairly scabbed over, should heal appropriately there. And again, just a touch cold at the finger there. Okay, so nothing particularly abnormal. Do you mind if I have you remove the hair ties? Thank you very much. Okay. I am just going to take an initial note here. So your left side, I do just see varied freckling. Nothing that appears overtly concerning there. And then if I can just have you flip your hand for me, I did just want to notate this one mark here. So about 2 inches down from the elbow there. Okay, and then on this side, I've got a scratch about 3 inches up from the wrist. And then a smaller one about 1/4 inch. Okay, and then I will just go ahead and document your henna just for sake of efficiency here. So starting at about the 3rd finger, about midway through the forearm. Okay. Alright, nails are healthy. Okay, so what I'm going to do is take an outline of each of your hands, and then it's basically just to allow me some place to write your measurements down. So I'll have you place a hand on either side, and then I will just spread your fingers apart here just slightly. Perfect. I'm just going to adjust the wrist there. Perfect. Okay. Doesn't have to be precise. As I stated, this is simply just for me to have a place to write your measurements down. Perfect. I'll have you lift your hands for me. It's like the cap to my bed came off. There we go. Okay. So I'm just gonna label these here. Very good. So I'm gonna start by measuring your left hand, if that's okay with you. So I just have a basic measuring tape here, so I'll just have you kind of gently extend your hand here. I'm going to start at the outer wrist, so about 6 inches from the bone there. Okay. It's about 3, right at about 3.5. Okay, so measuring thumb from the wrist, we are about 5.25. And the thumb itself is at about 3.5. Okay, now I'll take a measurement of just the top of the wrist here, so about 2.75 there. Now, if I can have you spread your fingers as far as you can, very good. It's about 6.5. I'll say about 6.25. and then bring them in as close as you can. Perfect. Right at about 4 inches. Okay, and then lastly for this side, I'm just going to measure the circumference of your wrist. Kind of in between, I'll say about 5 3/4. You're bordering 6 inches there. Okay, so let's go ahead and compare with the other side. Okay, so I'm going to start again here at the pinky. So just shy of 6 1/4 there. Inches at the pinky. Okay, so if you can spread your fingers for me. Very good. And then bring them in tight for me. And then lastly, just measuring the circumference of your wrist. Okay, so about the same as the other side. So. Okay. So I'm just going to look over these quickly and see if I notice any significant differences now. See a little bit of a difference here. So you have about a 1/2 inch difference from your left thumb to your right. Wrist size is about the same. Pinky size is the same. About a 1/4 inch difference at the ring finger. And middle finger is about even. Index finger is about a 1/2 inch off. And thumb is about the same. Are you left-handed or right-handed?
Left-handed.
You're left-handed, okay. So the measurements on your left hand were about a 1/2 inch bigger on average. So that can be typical just because you're using the muscles a little bit more, so they tend to grow longer. So I'm just going to go ahead and notate here that there was a variable about a 1/4 inch to a 1/2 inch. Second digit. But your wrist diameter was the same. Okay. All right, so we can go ahead and move on. All right, so let's move on to our secondary measurements here. Now I want to just have a look at some of the mobility in the fingers. So I'm going to go ahead and remove my gloves now that we've assessed your skin. Just clean my hands again, of course. Is there anything in particular you do to care for your hands as far as getting manicures, or do you just care for them at home?
I just care for them.
Just care for them at home. Okay. So I'm going to go ahead and just have a closer look at your skin before I move on to my mobility assessment. So Just want to look at some of these areas a little bit more in depth. So I'm going to look at your veins here. Do see some maybe mild distension there. So your nail beds are very healthy. Cuticles don't appear overly dry. The nails themselves are well nourished and appear well groomed. Just going to occlude the blood flow for just a second here to check for capillary refill. So as I hold down on your fingers, just looking at the return of color there. Maybe slightly delayed at the thumb. Okay. Now, have you always had colder hands and feet, or is that something that's slightly newer for you?
No, it's not new. I've always had it.
Okay.
I think my body just runs colder in general.
Okay. Okay, so not noting any issues with capillary refill on this side. Okay. Okay, so your arms are cold as well. Actually slightly warmer on the left. Okay. I'll have a look with my pen light here and see if I notice anything abnormal in the veins. So I'm just looking at your circulation, looking for any signs of occlusion here in blood flow to the fingers. So your veins are quite prominent, which is a good sign. I do see plenty of color there. Okay, no notable signs of distension here at the wrist. Okay. But I do notice just some slight distension here at the left. So there appears to be just a little bit of bulging here on the left side versus the right. Just going to take your hand here. Could just be an anomaly there. Any pain or tenderness here? No. No, good, okay. All right. Very good. And no irritation or anything associated with your henna there? No. Okay. Very good. You get another small scratch here at the third digit. About a half an inch from the knuckle there, so I'll just document that. Okay. So I'm just going to take a quick note of that small scratch there. I didn't notice the first time, so about an eighth of an inch. And it's about a half an inch up from the third digit knuckle. Okay. Alright, so we can go ahead and move on now. Because your fingers are just a tad cold, I want to do another test for circulation. So I have a stethoscope here, and this is going to allow me to listen for any signs of occlusion. So if I hear any areas where it doesn't sound like your blood is flowing adequately, then of course I will let you know. Okay, so I'm just going to have a listen starting at the inner elbow. Mhm. Okay, so I'm just going to take your hand here. Okay, so rate and rhythm are audible, just very faint, which does indicate a mild lack of circulation. Heart rate is normal though. Just going to listen at the palm. Okay, and then I'll just flip your hand over. I'm going to listen here. Perfusion there. Okay. All right. So definitely more prominent on this side. Just have you flip your hand for me. Okay, so lastly, just listening over the hand here. Now I am noticing a slight variable there. If I can just have you rest with both palms up for me, I'm just going to compare bilaterally here. I do hear just a slight difference. Nothing that I would say is significant, but it is notable. Okay. Right. Okay, so I'm just gonna have a look at the more prominent vein in your wrist here. Okay. All right, you can go ahead and relax your hands for just a minute. Just gonna notate here. I did notice a difference there. Nothing that I would say is particularly concerning, just one side of your body appears to be slightly warmer than the other, which is further explained by the fact that you have more circulation on one side than the other. So that's okay. I'm just going to go ahead and take a note of that. That's the left side, which is your dominant side, so that makes sense. Okay. All right. All right, so let's go ahead and move on let's go ahead and move on to our test for mobility. So I want to have a look and see if there are any differences in your joints as a whole, if you have any more mobility on your more dominant side or if it's about equal throughout. Okay, so some people do tend to lose flexibility or mobility on the side that they use less frequently. versus some people who could have a dominant hand tend to be more ambidextrous with use. So it could be that you're left-handed when you're writing, but you use both hands for everything else. Okay. So that's kind of like me too. I tend to use both hands for everything else, and the only thing I really do significantly with my right hand is writing or drawing. So we'll just have a look here. So I'm going to start with this side, and I'm just going to do a couple of rotations here. So just looking for any signs of rigidity there at the elbow and at the wrist as well. Just follow the fingers. So I will start with a couple manipulations where I move you around, and then there will be a couple where I display a movement that I'd like you to mimic. Okay? So for now, just testing for regular joint flexibility, which is well intact, not noting any rigidity at the fingers. Okay. Very good. Again, not noting any rigidity here at the finger. So I am going to perform an active flexibility, and I'd like you to just mimic. So if I can have you bring your hands up like this, good, and then back down, across your chest, and then across the other way, very good, and then extend down as far as you can, very good, and if you could raise your hands above your head, very good, and then down by your legs. I'm going to have you rotate your wrists like this. Any pain or tenderness there? No. If I could have you stretch your fingers out as far as you can, and then tight, tight, tight as far as you can. Very good. Okay, so doesn't appear to be any issues there. So I'm just going to test your fingers individually here. So just kind of go loose for me. I'm going to start with the individual joints here. No history of any previous hand injuries, correct?
None.
As much as we use our hands, it's actually not very common to have a significant hand injury. Noting just some slight rigidity here. So I'm just going to compare here, so I'll start. Okay, I'm going to hold these fingers down. I'd like you to try to raise your pinky as high as you can. Good. So now hold this, and if you can raise your ring finger, very good. And your middle finger, good. And your index finger, good. And of course your thumb should be able to move independently there. Good. Same thing on this side. Okay. Okay. Good. I'm going to have you try to move the two middle together. And same thing on this side. Very good. Did you feel any notable differences there?
This one was a little more difficult.
A little tighter?
Yeah.
Okay. So I noticed that as well. You do seem to have a little bit of rigidity here. So I am going to, let's see, so let's test that one more time. So go ahead and flex for me. So definitely a little bit of tightness there. Do this side one more time. Okay. So I'm just going to have a look here. bit of tightness mainly at the middle finger here. Okay. So I'm going to have you flex that middle finger independently there. Okay, is that as far as you can go? Okay. So it's about 3/4 inch there. So let's do the same on this side. Okay, so definitely a little bit of a difference there. Closer to about 1/4 inch on this side. Okay. Is it easier for you to do both of them? A little bit?
A little bit.
Still about 1/2 inch, 1/4 there though. Let's try this side again. Okay, so it is easier for you to do both of them as they're closer in proximity there. So just a little bit of tightness at the joint here, but it doesn't appear to be anything particularly concerning, so that's okay. It could just be an anomaly there. I'm just gonna have a look at the thumb here. So your wrists are fairly symmetrical. I'm not noting any obvious differences there. Slight difference here. It does look like this is just a little bit. Okay. Okay. All right, so let's see here. I am going to have you place your fingers, if you can, just like this for me. So nail beds together. Good. So just looking for any signs of gap there. So we'll do the same with your middle finger. Good. Good. Very good. Okay. All right. So it was the left side where you were having just a little bit of difficulty. So I would say about a grade 1, nothing super significant there. That was the 3rd digit. I'll say mild rigidity. Sure. Right side. Okay. All right. So we can go ahead and move on. I think the next thing I would like to do is percuss along your bony prominences. So I have a series of reflex hammers here. I'm going to start with this one. So it's just going to allow me to test 1 for your reflexes, and then 2 I'll move on to just doing a test for your joints, making sure that there's nothing going on with your bone structure. Okay? So I'm going to start here at the elbow. Any pain or tenderness there? No. External elbow, nothing there. Very good. So I'm just going to have you relax your hand very loosely here. Good flexion of the thumb, and then just relax your fingers. Very good. We'll do the same thing on this side. Any pain at all there at the elbow? No. Good. Definitely a more prominent reaction here on the right side. Just test that again. There we go. Okay. Good. So I'm just going to use this smaller hammer to test for the smaller joints at the wrist. So just relax for me. I'm just going to percuss around. noting any abnormality at the joint itself. So your skeletal structure does appear to be intact. There's nothing concerning there. I'm going to have you lay your hands flat for me. Just going to have another look at that capillary refill. I just want to make sure I'm not noting a difference here from either side. It's just that mild distension here. So I'm just going to use these caps to feel around at your skin texture. Now they're slightly rigid, just allows me to feel for any abnormalities. So say you were to have a bump, it just makes it a little easier for me to be able to feel it. So I'm just going to carry this down the length of your arms. So we'll start here at the external. Just a little bit of dryness there. I can have you flip your hands for me. Well, nothing notable so far. This side obviously is going to be slightly affected by your scar there, so I will be cognizant of that. So I am feeling some slight distension here at the vein. Any pain or tenderness here?
No.
No, good, okay. Okay. It's a very good skin assessment, not noting any signs of abnormality of the skin texture itself aside from the obvious there, so that is good news. So I am going to do a follow-up assessment of those just couple areas where I noticed some distension. So I have a tool that's going to allow me to apply a mild pressure. I want you to let me know if it causes you any pain or if it's uncomfortable, but I will just be applying just a little bit of pressure here just to see if there is any significant difference. So starting here, did notice a little bit of movement there. Okay, so it does appear as if your veins are just more prominent on that side. So could be just because that is your dominant hand. Did notice similar movement there, so that's a good sign. Slightly more mobile here. Okay, if you could flip this hand for me, there was another area here. think we can go ahead and finish up your examination today, and I just want to go ahead and test one more thing here. So if I can have you bring your wrist up like this. So I'm just going to test the curvature there. So right at about a 3. And right at about a 3. So both sides fall within about the 3rd parameter, which gives us an equal measurement on both sides. Pinky is just shy of 2. Slightly more shallow on the side. Okay. Fairly symmetrical at the midline there. Alright. Okay, Samantha, you can go ahead and relax. So I am going to conclude your hand examination today by just following up on my notes. So just a couple abnormalities. Nothing that I would say is particularly concerning. There's no person on earth whose hands and arms are exactly the same from one side to the other. So it's just good to note the slight differences so that if you come in for an annual exam or if you should have a hand injury in the future, we can compare to the notes from your initial visit. Okay. So I'm going to go ahead and write all of that down, and then obviously this will be updated to your electronic chart. Should you come in the next time, we'll have this as a reference. Okay. Well, I appreciate your time today. I will go ahead and get all of this in. You're welcome to put your hair ties back on. And I appreciate you for coming in. Thank you very much.